This is a short film showing how to take anterior dental periapical radiographs. So today we're going to focus on taking a periapical radiograph for an upper canine, lateral incisor or central incisor, or a lower canine, lateral incisor or central incisor. This is the film holding equipment you will need for the periapical radiograph: the blue vertical film holder, the blue aiming ring, and the vertical pronged metal attachment bar. When the blue film holder is attached to the metal bar, it will look like this from the side and like this from end on. When the blue aiming ring is attached, it will look like this from the side. This is the view looking through the aiming ring towards the film holder device to ensure that the film is in the centre of the targeted beam. This is a plastic anterior radiographic set, which when assembled looks like this from above and looks like this looking through the beam aiming device. Alternatively, it can be used without the ring aiming device, instead substituting it for this small narrow pointer that points exactly towards the middle of the film. Here we have a digital sensor plate in situ with the blue side and the dot facing towards the X-ray beam. When the digital sensor film is placed in its protective barrier, the black side of the protective barrier is facing the beam. To correctly position the film in the mouth, make sure that the correct side of the sensor plate or film is facing towards the X-ray beam and that the marking dot is towards the biting surface of the device holding the film in place. When using the plastic aiming device with a dental film in place, please make sure the dot is towards the bite block and the correct surface of the film is facing towards the X-ray beam. When taking the film, the ideal position for the film is in the highest part of the palate in the middle. A common mistake is to try and put the film just behind the central incisors, and therefore there's little room for the appliance to fit in the mouth. This position is a common mistake and is too difficult for the patient to close on the film holder and will result in a poor film. However, if the film is positioned in the midpoint of the palate like this, the patient will find it much more comfortable when they close together, and a good quality film will result. A dental roll is placed on the undersurface of the plastic bite block, and the patient asked to gently close until their teeth contact the bite block. The beam aiming device is then advanced as far forwards as comfortably possible, and the X-ray is ready to be made. This is the position for the plastic film aiming device. From the front, this is the position the radiographer will see, with the patient biting on the bite block using the tooth that you are investigating and want a radiograph of, and the beam aiming device centered over the X-ray film in the palate. This is the radiographer's view of the plastic film holding device. The collimator of the machine is then aligned with the beam aiming device, making sure that it is parallel with the metal prong of the film holding device. The appropriate settings are dialed into the machine and the radiograph is taken. When positioning for lower anterior X-rays, the assembly is exactly the same of the device. The positioning of the film is slightly different in that it is better to put the film immediately behind the incisors, where there is a little trough in the mouth that will accommodate it, rather than fighting against the patient's tongue. For lower arch radiographs, the dental cotton roll is placed against the plastic bite block and is facing towards the upper teeth, and the patient is biting the bite block with the lower tooth being investigated.